We have been committed to spreading facts, not fear, when it comes to coronavirus. And joining me now is Dr. Brooke Watts. She is the Chief Quality Officer at MetroHealth. And we've pulled questions from you, the viewers, to ask you because so many questions are out there. So big one, how long can the virus live on a surface?
Monica, I know this is a very popular question right now because of some recent scientific evidence that came out. This one question, though, makes me take a time out, okay? So the answer is, it can last for a long time on a lot of different surfaces. How does that matter for you, the community member, you, the viewer? I'm not sure it matters, right? So when we talk about risks from this virus, it's risk from being coughed and sneezed on by someone who's infected. That's the number one reason for transmission. So I hope folks don't take this little bit of evidence and get too worried about some of the very nuanced details. This thing about how we pick it up from surfaces really is probably not a large part of how we see transmission.
And the other thing is why we're telling everybody to wash their hands.
Yes, exactly. It doesn't change the advice we're giving you in general. Wash your hands. If you're sick, stay home. If you sneeze or cough, cover up.
What is the first symptom that everybody needs to be worried about if they think they might be infected?
Sure. So the most common symptom with COVID-19 or the coronavirus is fever. That's what we see in other viruses as well. But when we talk about fever, we're generally talking about something more than 100.4 or 38 degrees Celsius. For other folks, it's a little bit more of a cough. I know that the trouble with this right now, right, is that there's a lot of viruses out there. It's the time of year where you get a lot of colds. We still have a lot of flu in our community. And so I think for folks, we need to be thinking colds, we need to be thinking flu. Those things are still far more likely than the COVID-19 virus.
How long do those symptoms last typically?
Yes. So for a general cold, we think of that as being a day's sort of thing. With a virus, particularly like the flu, we can often have prolonged periods of fever. So sometimes we think of even 4 to 5 days of true fever. For COVID-19, it seems to follow a similar pattern. Some folks with the COVID-19 have had a longer prolonged course. Important thing to know here. It's very, very common to get a nasty cough after any viral illness. And that can persist for sometimes up to weeks of time, okay? So what we're really looking for in terms of thinking about resolution is when is that fever gonna go away, and thinking about the period of time, usually up to 3 days after that we ask people to still stay in close quarters.
No matter what at this point, if you think you might have it or you do, stay quarantined for at least 14 days.
Safest thing.
And that includes everybody in your house?
It's the safest thing, and truthfully, that's not any different than we'd say for any viral illness. If you have traditional influenza, we want you to stay home as well. So our recommendation, and we could talk a little bit about what that means for home quarantine, is that if you are sick, you stay home, and preferably you use a different bedroom and a different bathroom than your family members. It means you're washing hands, and if you're getting within 6 feet, you need to think about wearing a mask. It's also very important, as we talked about, to clean down those commonly used surfaces, especially if you're sharing a bathroom. But these are things we can do. We know how to do this. We got this.
I have a more specific question from one of our viewers. She would like to know if she needs to stay away from her grandkids. She has lupus, plus her autoimmune system is low from that lupus. Should she be staying away from the grandkids?
This is an important question. We know that folks who have suppressed immune systems, and lupus is a great example, may be at greater risk of complications of the COVID-19 virus. So in general, I would suggest that folks that have these kinds of conditions should think about who they're exposing themselves to. That being said, that does not mean you can't see your grandkids. There's other ways to do it than doing it in person. So we need to really focus on what we mean by social isolation and making sure we still stay connected within this picture.
So FaceTime, Skype,
that's right.
Talking through the window, whatever you can do.
Whatever you can do.
Writing letters.
Writing letters is my favorite.
All right. This individual works for a heating and cooling company. They deal with customers on a daily basis in their homes.
Yes.
Should they be concerned?
It's a great question, and actually one I haven't thought about before. But I think pragmatically, or if we think responsibly, the kinds of things that we talk about for preventing infection, like washing hands, are going to be particularly important for people who are going in and out of homes like this. If it's an individual that does have some of the conditions that we think of as being higher risk, the older age or immune suppression, you might want to think about altering work environments for a period of time.
Okay, and our third question, if you are infected, can your animals catch it, or can you spread it, or can your animals spread it by touching them?
So to the best of my knowledge at this point, we don't have any evidence that animals, or at least our domestic animals, are part of the transmission chain. Key point there is, as we talked about before, this is droplets. It's virus, it's virus coming out when you cough and you sneeze. So if you're sick, let's try not to cough and sneeze on your animal, and probably best to stay away for a little while. But it isn't that the animal is causing or carrying the illness.
How is the virus spread with people who are asymptomatic? And if they're not coughing and sneezing, how do they make somebody else infected?
Sure. So this is an area of the COVID-19 virus that we're really still learning about. In general, we think of people as being the most infectious in the hours right before they start to have symptoms or immediately after they have symptoms. But it's becoming more clear that there probably is some transmission when people are asymptomatic. The reality is that our bodies carry around a lot of different things at different times, including a lot of viruses, and that we may be shedding in those times when we don't know it. That being said, it doesn't change the advice we've already given, which is if you are sick, stay home, because it's clear that that really is the highest risk time for shedding, and also, again, for you to be able to protect yourself and stay safe.
All right, can my family members hug, or should we stay away from each other in the home?
Well, I think this comes back to symptoms. So certainly if you are sick, we would not recommend that you have close contact with your family members. In all of this, it's really important for us to think about how we stay connected, particularly with our children who might be scared during these times. If you're healthy, I don't see any reason that you shouldn't be supporting your family in every way they need, including the physical contact that they need to stay safe and feel supported.
And last question, if you've had the virus, can you become reinfected?
Yeah. This is another question that continues to evolve. Traditionally, we think of when we have viral infections that your body may have some component of immunity that helps you to either not get it the next time or to have maybe a smaller, milder impact. I honestly am not sure we know the answer to this right now, but certainly it's going to continue to evolve as we see more cases.
All right, Dr. Watts, thank you so much. Keep your questions coming. We have a lot of doctors who are going to do their best to answer them.